Plantar fasciitis is a common condition that causes pain on the bottom of the heel. People sometimes refer to it as a heel spur. It's common in runners and people that stand or walk a lot during their job or with recreational activities. There are many different ways to treat plantar fasciitis, and when patients come to see me in the office, most of them have already tried some type of over-the-counter anti-inflammatory medication, some stretches they might have read about on the internet, some modifications to their shoes, or they might have taken a week off of their running, and they come to see me because their symptoms are progressing and not getting any better. Non-operative treatments for plantar fasciitis usually consist of a prescription anti-inflammatory. Sometimes it can be used topically or taken orally. We'll have people start a pretty regimented stretching program. We also try modification to their shoes, typically with a good over-the-counter insert. We also talk about using ice and something called a night splint, which is a splint you sleep in to keep your foot in a certain position. If people continue to have pain with plantar fasciitis and are not responding to the first line treatments, other things that are considered would be an injection using cortisone. Other options might be formal physical therapy, immobilization in a walking boot, and sometimes even the use of a cast. The most common surgical procedure is typically an open or endoscopic partial release of the plantar fascia. The biggest issue for people that have a plantar fascia release is that there's typically several weeks of limited weight bearing. It can be up to 6 weeks that you may have to be in a cast or a boot. Now at Advanced Orthopedics and Spine, there is a newer treatment for plantar fasciitis that has several advantages over surgical treatment. This treatment is called extracorporeal pulse activation technology, or we refer to it as Epat. Epat is usually performed as a series of 5 treatments done weekly, and each treatment lasts approximately 10 to 15 minutes. Research studies indicate that the effectiveness of Epat is around 80%, which is comparable to the surgical treatment for plantar fasciitis. The advantages, though, are that the patient is able to immediately return to their normal activities again with no downtime. The technology behind Epat has been FDA approved for over 20 years. I've been performing these procedures on patients here at Advanced Orthopedics and Spine for the past 5 years.